What's your advice to other doctors considering outsourcing, and how can that help reduce workload, improve their efficiency and patient care, and so on and so forth?
Sure. So I think, I had some of the same questions that most people have. And I feel like, trying something out is important because, somebody can tell you things. I'm a little skeptical when it comes to people saying, okay, we'll just try this out. So I would say, for our practice, I had a hard time, we do have staff in-house, but we did have a problem with retaining staff. Right. So it was like I would train somebody and then they would be there a couple of months and then they would not come. And so I needed a little bit of reliability as well. So that's why I looked into, outsourcing a couple of things. Um, and so I think for our practice, you always have to remember, though, if you are looking at this, you have to kind of know or kind of look at your practice and see where can somebody be helpful. So for us, for example, we already have a billing company that does verification. So that wasn't something that I needed. I needed somebody who's going to schedule, answer the phone, and kind of take messages as well, and then prior auths. We also do still have paper charts, so I am scanning, uploading scanned documents to our EMR. So our virtual person helps with that as well. So I think for physicians thinking about using outsourcing, it's important to also know that it's not just it's like an ongoing process. You do have to be involved in how you train a little bit because you're the one who knows how your office works, how the EMR works. So coming up with solutions to a problem, that's also very important because if you can do that, you can really target where this person can come in and help. So I think it's been helpful in the sense that I have somebody who shows up, most of the time, well, all of the time, because it's only been a couple of months since I've been trying this out. So I think, taking off those tasks that usually you're burdened with gives you more time to do other things. Like for me, the timing of finding out what medications are covered, somebody else could be doing that while I'm seeing the patient so that I can get back to them in a more timely manner. And figure out whether we need to do a prior auth or we need to switch the medication. So that's been helpful as well. Obviously, it doesn't replace your internal staff, but I come up with things that my virtual person can help me with. So you really have to kind of understand where you need that help. So
Thanks for tuning in to Healthcare Talk Show.